everyone. I'm going to present the findings from my work with super-resolution of CT scans of human bones. Super-resolution is the task of enhancing low-resolution images by training a model with examples of image pairs of both low and high resolution so that it learns the mapping between them and can generate a high-resolution image given only a low-resolution input. My main takeaway is that we need to look at both the data that we use to train our models as well as the metrics that we use to evaluate them. There were two issues with the field of medical image super-resolution that we wanted to explore further. The first was that in all research we could find, none of the models were trained on real data, meaning data where some specimen had been scanned at two different resolutions to produce corresponding low and high resolution image pairs. Instead, they were trained on synthetic image pairs, where the low-resolution image was produced by downsampling and perhaps blurring the high-resolution image. We wanted to explore whether this made a difference for the trained models. Second was that even though it's quite well established that the simple image similarity metrics, such as the peak signal-to-noise ratio or the structural similarity index measure, are poorly suited for medical images, they're still widely used because they're simple, easily comparable, and no good alternatives have really been established. So we wanted to know how this affects the process of selecting the best model after training. To investigate the data issue, we created a data set of bones that were scanned at two resolutions and then registered to produce corresponding volumes of the bones at both high and low resolution. When evaluating the models, we calculated bone measures used for clinical analysis of bone quality on the super-resolution model output and compared it with the ground truth measures of the high-resolution images. This was then held up against the simple image similarity metrics, PSNR and SSIM. The FACT dataset consists of 13 proximal femurs from archaeological human bones. They're scanned with both a clinical CT scanner as well as a laboratory micro-CT scanner, and the resolution difference is about 1 to 4. The volumes are registered with ITQ-SNAP, ensuring voxel-to-voxel correspondence. We're making the dataset publicly available for download so that other researchers may use it as a benchmark when evaluating medical image super-resolution models. So, on to the results. When comparing models trained on real and synthetic data, we see that the synthetic data holds more detail about the microstructure than the real low-resolution data. So even though we've matched the resolution difference when downsampling the high-resolution images, we're still retaining detail that's not available in the actual low-resolution clinical CT scan. This is evident in these images since the synthetic super-resolution output matches the microstructure of the ground truth exactly, whereas the real super-resolution output gives realistic structure but is not an exact match with the ground truth. The second result is that during the evaluation of the models, it's also revealed that the clinical bone measures they really added some valuable insight when selecting the best model for super resolution. So it's clear that the image similarity metrics do not reflect when the model is producing non-realistic structure. So when we use the image similarity metrics as a way to choose the best model, we see that the output is not what we want. Thanks for your attention. My name is Sophia. I'm a PhD student at the Technical University of Denmark, and the paper is co-authored by my supervisors, Vedrina Date and Anna Date from DTU, and Chiara Villa from University of Copenhagen, as well as my collaborator, Galadia Kazakia from University of California, San Francisco. My project is funded by SOLID, the ESS Lighthouse on Hard Materials.